Welcome to the podcast. Before we begin, there is a disclaimer we have to make. Let's Talk Wellness Now brings expert insights directly to you. Please note that the views and information shared by our guests are their own and do not necessarily reflect those of Let's Talk Wellness Now, its management, or our partners. Each affiliate, sponsor, and partner is an independent entity with its own perspectives. Today's content is provided for informational and educational purposes only and should not be considered specific advice, whether financial, medical, or legal. While we strive to present accurate and useful information, we cannot guarantee its completeness or relevance to your unique circumstances. We encourage you to consult with a qualified professional to address your individual needs. Your use of information from this broadcast is entirely at your own risk. By continuing to listen, you agree to indemnify and hold Let's Talk Wellness Now and its associates harmless from any claims or damages arising from the use of this content. We may update this disclaimer at any time, and changes will take effect immediately upon posting or broadcasts. Thank you for tuning in. We hope you find this episode both insightful and thought-provoking. Listener discretion is advised. Now for the show.
Hello and welcome to today's episode, Estrogen and MS, How Hormones Impact Neurological Health and Symptom Management. I'm Dr. Deb, and today we're diving into a fascinating and complex topic, the link between hormones, specifically estrogen, and neurological health in women, particularly as it relates to MS or multiple sclerosis. Today we'll explore how declining estrogen levels in women may not only trigger MS, but also impact the severity and the progression of symptoms. Estrogen is more than just a reproductive hormone. It plays a crucial role in our immune system and the nervous system health. This intersection of hormones and neurological health offers insights that may lead to improved management and treatments for women with MS. So, to provide some context, estrogen is a hormone that does more than govern reproductive functions. Research shows that estrogen plays a protective role in the brain, and it can reduce inflammatory responses, promote cell repair, and support overall neurological function. It's fascinating to consider estrogen's far-reaching impact on the nervous system, and as we'll see, the effects are particularly relevant in the context of MS. MS is about 3 times more common in women than in men, and research suggests that hormonal fluctuations significantly influence both the risk and expression of MS symptoms. This gender difference points to hormones, and especially estrogen, as an area worth closer examination. So let's dive deeper into the science to understand why estrogen is such a significant factor in MS. So estrogen as a neuroprotector? Really? Well, it's true. Estrogen provides significant neuroprotective benefits by modulating inflammation and oxidative stress in the brain. And studies have shown that estrogen can decrease levels of pro-inflammatory cytokines while enhancing antioxidant defenses, creating a protective environment for neurons. Research has shown that women with higher estrogen levels tend to have lower markers of neuroinflammation, which is critical because inflammation in the brain can lead to damage over time. And this protective effect of estrogen helps keep the brain in a healthier state, which is particularly beneficial for managing conditions like MS. Now, estrogen has an impact that goes even further than that. It's called myelin. So myelin is the protective sheath or the coating around the nerves, and it's essential for nerve communication. And estrogen plays a direct role in supporting this myelin repair. So let me explain a little bit more about myelin, because I think it's important for us to understand. If you think of your nerves as an electrical wire, we've all seen electrical wires that go behind the walls, right? And you pull out that wire, and if you've done any kind of remodeling, you may or may not have seen somebody strip away that plastic coating. Sometimes it's yellow, sometimes it's blue. And inside there are a couple of wires. Sometimes there's one, sometimes there's two, sometimes there are three. So think of that plastic coating as the myelin that protects your own nervous system. And what happens in MS and sometimes other neurodegenerative diseases is that protective coating, that myelin, becomes disrupted or becomes damaged. And when it becomes damaged like that is when the nerves can be exposed. And when the nerves can be exposed, they can become irritated. And that's kind of what we're talking about with what happens on a very low scientific level with MS. But I think everybody can understand when we're talking about that, what exactly is happening there. So estrogen, which is one of my favorite hormones, by the way, and I have been promoting hormones my entire career. I started learning about hormones when I was in my mid 20s. I worked for a reproductive endocrinologist and became so in love with hormones and so fascinated by them and what they can do and how they affect us. And I really believe that over the years, hormones, especially estrogen, have gotten a really horrible rap, and they didn't need to be. So I'm a proponent of it. I do not like synthetic hormones. I really love bioidentical hormones. And you can find an episode here in the beginning of my series that goes back a couple of years that talks about all the hormones and why I love them so much. And what's the difference between bioidentical hormones and what's the difference between synthetic hormones? It's all there for you. So go back and check those out. But let's get back to the episode today. It's so easy for me to get off on a tangent. I'm so sorry, you guys. So estrogen stimulates the cells, and these are called oligodendrocytes, which are responsible for myelin production. Animal studies have actually shown that estrogen can increase myelin's thickness and even support remyelination, a critical process for people with MS, where myelin damage is a core part of the disease. And this finding gives hope for ways to support or restore the nervous system's function, actually in MS. And so there is a huge gender discrepancy between women who develop MS and men. It is something that affects women more commonly than men, and particularly during those reproductive years. This suggests to us that female hormones influence this disease, and symptoms of MS often vary with hormonal changes such as puberty, pregnancy, menopause, leading further to the support of this idea that estrogen plays a significant role in how MS manifests and progresses. So, hormonal decline can disrupt the immune system. We call it immune dysregulation. As estrogen declines during menopause, the immune system changes and it becomes apparent. We all know that as we get older, our immune system doesn't work as well. This is why everybody's advertising to the elderly population to get your vaccines and to do this and to do that. There are much easier ways to stimulate the immune system than that. And I can talk about those in a different series as well. But today I want to focus on how estrogen, the decline of estrogen, can actually lead to an immune dysregulation, increasing the risk of autoimmune activity, which can amplify MS symptoms. A study from the Journal of Immunology found that postmenopausal women with MS tend to have higher levels of pro-inflammatory markers, which can lead to worsening symptoms like fatigue, pain, cognitive difficulties. And this means that estrogen decline doesn't only affect the body in general, but may also directly impact MS symptom intensity and estrogen's anti-inflammatory role. So estrogen naturally has an anti-inflammatory property to it, and when estrogen levels drop, pro-inflammatory cytokines rise, leading to increased brain inflammation, which may worsen cognitive issues and sensory disturbances in MS. And research has published in Neurology in 2020 found that women with MS who had lower estrogen levels, they showed higher inflammatory markers, correlating with more intense symptoms. And these patterns offer insight into why women may experience a surge in MS symptoms as estrogen declines. Now, there's also compelling evidence that MS relapse rates increase during perimenopausal time. a time that is marked by fluctuating and declining estrogen levels. There was a review in the British Medical Journal that found that women in their perimenopausal age experienced a 30% increase in relapse rates, which researchers attribute largely to that estrogen drop. Now, is there clinical evidence supporting hormonal replacement? Yes, there is. BHRT has a potential therapy in MS and I believe other neurological diseases as well. Hormone replacement therapy or bioidentical hormone replacement therapy has shown promise for alleviating some MS symptoms in menopausal women by stabilizing estrogen levels. So for some women, BHRT can improve symptoms like brain fog, fatigue, cognitive decline associated with MS. And there's another study published in Multiple Sclerosis Journal that found that women receiving hormone replacement therapy reported better cognitive function, less fatigue than those who didn't receive it. These findings offer hope for using hormone replacement therapy as a part of the MS treatment plan for women in menopause. So, how does hormone replacement therapy actually work to help MS symptoms? Well, we know that hormones may reduce inflammation, protect the nerve cells from damage, and even support myelin repair. And this combination of benefits means that women on hormone replacement therapy could experience fewer symptom flare-ups and potentially a slower disease progression. In a small clinical trial published in Neurotherapeutics, MS patients on HRT showed improved markers, MRI markers actually, of their brain health, suggesting a protective effect on brain tissue. These results indicate that hormone replacement therapy may indeed have a therapeutic benefit in managing MS symptoms during menopause. Now, there are practical considerations that we need to think about when we're doing bioidentical hormone replacement therapy, BHRT. While this shows promise, it is not a one-size-fits-all solution. Each patient's hormone levels, MS progression, and the overall health are unique. Age, symptom severity, and pre-existing health conditions must all be considered before starting HRT. Women interested in HRT should consult their healthcare providers to determine if this is a good fit for them. We have to be cognizant of this. We have to be cautious. Women with a family history of breast cancer may not benefit from hormone replacement therapy. Women that have clotting disorders cannot use hormone replacement therapy, at least estrogen. Are there other hormones that we can use? Yes. Will they impact neurological disease as well as estrogen? We're not sure. Maybe or maybe not. So everything that we do in healthcare in general, in my opinion, should be a very personalized, individualized plan. But that doesn't always happen. So make sure you have these conversations with your healthcare providers. Find out if you're a candidate or not. And then don't rely on a traditional primary care practitioner to manage your hormone replacement therapy for you. Make sure you're working with somebody who's skilled and knowledgeable in hormone replacement therapy. There is a very distinct difference in people who do this as a passion, have studied this for decades, who know what they're doing, compared to someone who's just doing this as a small piece of their practice and they're just prescribing the traditional therapy. I think that's a huge thing to take into consideration. The other thing is there is a difference between using synthetic hormones and using bioidentical hormones. They are different. Synthetic hormones are made from horse-based estrogens, which we don't contain in our body, at least the majority of them. Bioidentical hormones are plant-derived, and these hormones are much better for us. They're molecularly the same as what our body produces. So if I took a molecule of a bioidentical hormone that I'm going to use for hormone replacement therapy and a molecule of that same hormone, say estrogen, from your body, and we looked at them under the microscope, I would not be able to tell the difference between the two. They would look identical. And that's what we want, because we don't want the body to not be able to recognize this, not know what to do with this, and then we have other side effects and other problems that we weren't expecting. So it's really, really important, guys, to work with somebody who understands this. If you could work with somebody who has the neurological background and hormones together, that's even better. But there are very few of us practitioners out there that understand the neurological components of disease from an alternative perspective and hormone therapy at the same time. And so even if you can't get a person like that in your state to prescribe, you could always find a consultant who can help manage how to prescribe those hormones. Oftentimes, a good place to look for that is your local compounding pharmacy. Often they will have practitioners that they work with that are very good at this. They may even give direction to that practitioner if they don't know how to prescribe. They can give them some direction in how to do that until that person starts to learn more. So it's really, really important to have all of the information that you're looking for when it comes to prescribing this hormone therapy. Now, there's also some really exciting research that's currently underway to understand estrogen's effects on the brain and MS. By continuing to study this connection, we hope to refine our understanding of who might benefit most from HRT and develop more targeted ways to support neurological health in MS through hormonal support. So, integrating that knowledge between estrogen into MS management is key. And declining estrogen is not merely a reproductive issue, it has profound effects on the brain and the immune system and may trigger or intensify MS symptoms. This makes hormone support a potential pathway for improving the quality of life in women with MS and other neurological conditions. So, by staying proactive and openly discussing hormone health with MS patients, healthcare providers can help women make informed choices about their options, including bioidentical hormone therapy. As research advances, we may find more refined, targeted ways to leverage hormonal health to improve MS management and the quality of life. This is really exciting stuff. I'm super excited as an MS person myself. I love hormones. I always have. I've taken personally hormone replacement therapy since I was 28 years old. Started with progesterone, and now I take estrogen and progesterone. The key is to replace back what is necessary, what you're deficient in, what your loss is, to not just have the benefits of not having hot flashes and night sweats. That's great, but that's not the only benefit. And that's usually what drives women to hormones, but it's not what keeps them on hormones. There are a few vanity issues that I love to talk about with hormones. It makes our skin look better. It makes our hair function better. It makes our sex life better. All of that is improved as well. But it's that neurological component, that memory, that focus, our mood, our body's ability to move more and be more flexible and just overall stay younger and healthier longer. To me, that's key about replacing hormones. And I love that we're starting to look at this in a different fashion, and we're starting to do research on how important it is to replace estrogen in these days because of neurological conditions, and the neurological conditions are advancing even more. So it's exciting to see we're in a great time here. And there are many other things that we can do to help with MS. Today's episode, though, I really just wanted to focus on estrogen, and we'll dive into some of the other things later in other episodes that can keep our nervous system healthy and stronger longer. So that's all I have for today's episode. Thank you for joining us as we explore the complex relationship between hormones and neurological health in MS. Be sure to tune in next time as we dive into another topic designed to bring new insights to your understanding of health and wellness. And I'd like to humbly ask, if this episode was helpful for you, or you know somebody that could benefit from this episode, please share it with them. Our goal is to spread knowledge and information about health as much as possible and reach as many people as possible. And don't forget to like, subscribe, and share so you know when our next episode is coming live. Thank you for joining me today.